you got burning pain in the stomach after meals. It may not just be gas or acidity, it could be an ulcer. Do you know do you know that one of the most commonly used NSAID medication can cause bleeding ulcer? If you have a stomach pain, black stools, unexplained vomiting, this video could be very important. Ulcers are treatable, but only if you know what's causing them. Hello everybody, I'm Dr. PK Pankaj Karan, and today in this video we're talking about peptic ulcer disease, also called PUD. A peptic ulcer is basically an open sore in the lining of your stomach or the first part of your small intestine called the duodenum. The two biggest causes are Helicobacter pylori infection and often called H. pylori, and second one is the regular use of NSAID pain medication like ibuprofen, naproxen, aspirin. Diagnosis commonly involves upper endoscopy and testing for H. pylori, while treatment usually includes acid suppression, treating H. pylori present, and stopping ulcer-triggering medication when possible. So, what is peptic ulcer? Your stomach normally makes strong acid to help digest food. At the same time, your body protects the stomach and duodenal lining with mucus, bicarbonates, good blood circulation, and repair mechanism. An ulcer forms when the balance is broken, either because there is too much injury or too little protection. Ulcer goes deeper than a simple irritation and actually penetrates to the mucosal surface. Peptic ulcer most often occur in the stomach or duodenum. There are two main types, gastric ulcer and duodenal ulcer. Both are part of peptic ulcer disease, but they can behave a little differently. For example, duodenal ulcer pain may sometimes improve briefly after eating, while the gastric ulcer pain may worsen with meals. Symptoms can overlap, so testing is important rather than guessing. Main cause of peptic ulcer. So, H. pylori infection, this is one of the most important causes worldwide. H. pylori is a bacteria, that Helicobacter pylori is a bacteria that can live in the stomach lining. Over time, it causes inflammation and weakness of natural protective barrier, making ulcer formation more likely. It is also associated with gastric ulcer and certain kind of lymphoma, which is why finding and treating H. pylori matters. Number two, NSAID pain medication, second major cause of frequent use of NSAID, such as ibuprofen, naproxen, diclofenac, aspirin. These drugs reduce prostaglandins, which normally protect the stomach lining. Without the protection, acid can injury more easily. So without protection, due to this medication, acid can cause injury more easily. So NSAID use and H. pylori are independent risk factors. That means if they are together, they can raise risk even more. Less common cause, people who are hospitalized under severe physiologic stress, they have a stress ulcer. Smoking can worsen healing. Alcohol use, which can aggravate symptoms, and sometimes acid production, overproduction in a condition called Zollinger-Ellison syndrome. Certain medication, if combined with NSAID or aspirin. Contrary to popular belief, stress alone and a spicy food alone usually do not cause ulcer, but it can make the symptoms worse if you have pre-existing ulcer. So the two big causes remain H. pylori and NSAIDs. So what are the symptoms? Many people think an ulcer will cause severe pain That is not always true. Some ulcers are silent until a complication happens. Although when present, the common symptoms include burning or gnawing pain in upper abdomen, pain between meals or at night, bloating, nausea, early fullness, indigestion, sometimes vomiting. But dangerous symptoms are the ones people should not ignore. Black, tarry, stool, vomiting blood, coffee ground vomit, sudden severe abdominal pain. This can signal bleeding, perforation, and obstruction, and those are emergencies. How peptic ulcer is diagnosed? Clinical history, nature of your pain, are you using NSAID, aspirin, smoking, alcohol, weight loss, prior ulcer, vomiting, black stool, testing for H. pylori, urea breath test or stool antigen test, upper endoscopy, the most important test. Especially if someone has alarm symptoms like bleeding, anemia, weight loss, repeated vomiting, trouble swallowing, older age with new symptoms. So an endoscopy lets the doctor see directly the ulcer and sometimes take biopsy. Diagnostics of peptic ulcers commonly made with endoscopy and H. pylori testing. A proven gastric ulcer often needs repeat endoscopy after treatment to confirm healing and make sure something more serious is not missed. How to prevent peptic ulcer? Number one, use NSAIDs only when necessary. Avoid taking painkillers on empty stomach. Ask your doctor whether you need a PPI for stomach protection. If you need to be an NSAID, for example, many times we'll combine ibuprofen with omeprazole. Test for and treat H. pylori when appropriate. Stop smoking, limit alcohol. Those are important. Stop the gout like NSAID when possible. Acid suppression with proton pump inhibitor PPI like omeprazole, pantoprazole, or similar medication for 8 weeks. Eradicate H. pylori infection must be treated with combination regimen that usually include a PPI, antibiotics, and sometime bismuth, depending on the regimen. 224 ACG guidelines addresses evidence-based treatment of H. pylori infection, which is important because resistant patterns matter and therapy should be chosen appropriately. Confirm eradication when indicated. After treatment of H. pylori, you should repeat the breath test or stool antigen test to make sure infection has been cleared. Now, you got to manage complication urgently if there's evidence of bleeding or perforation or blockage, hospital admission, IV medicine, endoscopic treatment, sometimes even blood transfusion. So peptic ulcer disease mainly includes gastric ulcer, duodenal ulcer, two biggest cause, H. pylori, NSAID. Diagnosis includes H. pylori testing, upper endoscopy. Treatment includes acid suppression, eradicating H. pylori, and avoiding trigger. And remember, if you have black stool, vomiting blood, severe abdominal pain, fainting, weakness, you got to seek urgent medical care right away. If this video helped you understand ulcer better, share with family, friends, repost it, because the symptoms may look common, but the complication can be serious. Thank you for watching.